This is a research proposal by Chelsea Norris for Colorado Christian University. In the United States, over 31 million children live in poverty, and 12 to 54% of women, as well as 4 to 15% of men, report experiencing sexual abuse in childhood. Due to underreporting of sexual abuse, this statistic is likely higher. These statistics are important because brain development is altered due to growing up in poverty and childhood sexual abuse. Researchers have discovered a link between adverse childhood experiences and increased healthcare costs later in life. The purpose of this qualitative exploratory report is to research resiliency factors and effective treatments that may work to protect an individual from the effects that sexual abuse and poverty have on the developing brain. This research will utilize reality theory to compare the effects as well as investigate effective treatments for child sexual abuse and mitigating factors against growing up in poverty. However, there is limited research on resiliency factors. The question we will be researching is what resiliency factors are known to protect the brain in the cases of childhood sexual abuse and childhood poverty. In order to research this question, I propose a research study on two populations. This study will include every child who is receiving home visits between August 15, 2017 and May 15, 2018 from Nurse Family Partnership, Prenatal Plus, Early Head Start, or the Bright by 3 program. This study will run for 3 years. This study will also include children between the ages of 5 and 16 in Larimer County who are receiving counseling services for sexual abuse. This study will begin August 1st, 2017 and run for 3 years. The number of children in each study should not exceed 350 children, though a statistical analysis will be conducted to determine the appropriate power and sample size required for each study. We're researching resiliency factors using healthy children in Larimer County. The main role of the researcher is to conduct home visits to collect assessments and observations in the event the family drops out of or completes their counseling services or home visiting program. The researcher will also maintain contact with the home visiting programs and counselors to track participants' assessments and address any concerns. The researcher will also collect the assessments from home visitors and counselors. Participants were selected based on their residing in Larimer County, being healthy children with no major health concerns or history of brain injury. Children are also selected based on no parent drug use during pregnancy, particularly in the poverty study. This is also included in the child sexual abuse study, if at all possible, and this history is known. And children in the child abuse study must have the perpetrator convicted guilty in court, or the participant was removed from custody by DHS due to these allegations. For this study, each child will receive an MRI at the beginning, at the 1.5-year mark, and at the conclusion of the study. Every 6 months, all parents will complete the Nurturing Skills Competency Scale, the Beck Depression Inventory, and the Parenting Stress Index. All parents involved in the child abuse study will also complete the forms appropriate for the child's age, which include the Trauma Child Checklist, the Trauma Symptoms Checklist for young children, and the Child Behavior Checklist. If the child is old enough, the child will also complete the Youth Self-Report every 6 months. Children in the poverty study will continue to receive home visits based on their program's designed instrumentation style. The number of home visits received will be counted and changes in assessments will be monitored and analyzed at the end of the study to assess for possible correlation between home visits and resiliency factors increased. Assessments will also be analyzed for nurturing parenting and possible correlations with resiliency factors. Children in the sexual abuse study will be divided into two groups. One group will receive the play therapy intervention, and the number of sessions will be counted. The second group will receive mindfulness-based counseling, and the number of sessions will also be counted. Assessments will be analyzed for correlations between intervention and resiliency factors, and the assessments will also be assessed for correlation between nurturing parenting and resiliency factors. Whenever possible, counselors or home visitors will obtain data and assessments for the researchers. This will allow for minimal intrusion into the participants' daily lives. Researchers will develop and maintain contact with home visitors and counselors in order to assure that program requirements are being maintained and that ethical procedures are being followed. Client information will be kept confidential by giving clients an identification number at the beginning of the study. Client files will also be locked away as required by state law. The assessments chosen in this study are valid and reliable, and often utilized in other studies. The home visitor, counselor, or researcher will conduct a short interview every 6 months to determine continued eligibility. This will include questions about basic health and rule out head injuries and other major trauma. Scientific and medical imaging will be utilized to determine brain changes and actually see what is happening. At the end of the study, blind experts will be brought in to assess the data and do so without bias. As stated before, researchers will track the number of home visits or counseling sessions each participant receives throughout the study. Home visitors or counselors will recruit, explain, and obtain permissions for the study. Researchers will track which intervention the child receives, either which home visitation program the child is participating in, or whether they receive play therapy or mindfulness-based therapy. Families will be compensated for their time by receiving a gift card to a major store each time they participate in receiving an MRI. Assistance will be provided to obtain the required MRIs in the form of a bus pass or a taxi fare if the family needs this assistance. Also, a translator will be provided if necessary. All assessments will be scored by researchers. When all studies are completed, blind expert analysis will take place. They will focus on the amygdala, hippocampus, gray matter, and overall brain size, as these have shown to be important in other research. Children who drop out of their home visiting programs or counseling services prematurely will be compared to those who completed services. Children whose parents scored higher on the NSCS, Nurturing Skills Competency Scale, will be compared to those who scored lower. These comparisons will be made only with children of the same or similar age, and with the understanding that there may be other factors in play. This research helps understand how home visiting, play therapy, mindfulness-based therapy, and parental nurturing impact brain development and resiliency. This can help create programs to increase resiliency factors, which will reduce public health costs. This is not easy research, as child sexual abuse and child poverty are not easy topics and can be hard on your heart, on your mind, and on your soul. Meditating on Joshua 1:9 can be beneficial. Have I not commanded you? Be strong and courageous. Do not be terrified, and do not be discouraged, for the Lord your God will be with you wherever you go. Thank you.